those muscles. Exercises targeting core muscles, the abdomen and back are effective. Tai Chi, and probably yoga and Pilates. I will mention that there's been some very recent literature that yoga, we've got to be a little careful with hyperextension with people that have got osteoporosis, etc. It might increase their risk of fractures, but I think overall yoga is probably great. One of the best exercises you can possibly do is probably walking. The more you walk, the better. I don't care how old you are, you should get up and walk. I also give credit to Mark and his group. I think they do an excellent job of making exercise programs available to us that would be tailored to what you need. In fact, I can't think of anybody that we wouldn't recommend exercise to try to prevent falling. So let's talk about the risk of fracture, and I've already mentioned this. Osteopenia, osteoporosis, thin bones. So what are thin bones? So on the left is a picture of a bone that's normal. On the right, you can see this holy looking thing. That's an osteoporotic bone. So normal bone is a process of both rapid growth of bone and reabsorption of bone, and it forms a mesh. If the formation of bone exceeds the breakdown of bone, you get strong, normal bone. If the breakdown exceeds the formation, you get what you see on the right is this really weak Swiss cheese. So that's what we're really concerned about. So what causes osteoporosis? Well, a sedentary weight, low levels of weight-bearing exercise or a sedentary lifestyle. Unfortunately, that's often the sine qua non of people getting old. So not surprisingly, aging and osteoporosis go together. Low levels of estrogen, postmenopausal women. Obviously, estrogen is a big part of their bones, and they become postmenopausal. Estrogen drops and their bones weaken. Men don't escape it. Testosterone actually drops. Men are about 10 years behind women in terms of bone loss. They start off with bigger bones, but men have problems with osteoporosis. So an 80, 85-year-old man and your risk for falls, you should be concerned about your bones. Women, 65 on up, you should be concerned. Obviously, there's a lot of medical conditions that affect calcium, vitamin D, etc., that contribute to osteoporosis. And then there are medications. Corticosteroids are probably on the top of the list. So how do we assess bone mineral density? There is a very simple test called a BMD, also known as a DEXA. This is a low-energy X-ray assessment that gives a snapshot of bone health. Measurements are done at the hip and the spine. It is totally painless. And the way this is scored, an individual's bone mineral density is compared with the bone mineral density of an average healthy 30-year-old female. Now, how is this reported? And I will make a case. If you don't know your bone mineral density T-scores, you should. It's probably as important as your cholesterol, your blood pressure, and anything else. So bone mineral densities are reported as T-scores, and they're scored at both the spine and the hip. And what you will get back is a score where 0 means your bone is equal to that of a healthy 30-year-old female. So anywhere a score of -1 to +4 plus numbers means your bone is stronger than a 30-year-old. They'll usually consider normal down to -1. If you get a score between -1 and 2.5, you have low bone mass density, osteopenia. A score less than -2.5, you've got osteoporosis. And if you've got a score of less than 2.5 and you've had a fracture, spine, hip, wrist, rib, you have severe osteoporosis. So you are at great risk. So this actually just shows us in a numerical scale. So everything to the right from -1 all the way up represents normal bone density. Again, comparison to a 30-year-old, and then going down shows osteopenia and osteoporosis. So again, get your bone mineral densities done, ask what your T-scores are. And these kinds of numbers are very, very, very meaningful. So why are these so meaningful? Is that fracture risk increases progressively at scores less than -1. Fracture risk is dramatically increased at t-scores less than -2.5. And this includes hip fractures, vertebral fractures, wrist fractures, rib fractures. So the question is, how often should you be screened? One, it depends on your risk. If you're at high risk for falling, you need this screened now and probably every 3 years. If you're 65 years old, healthy, low fracture risk, you've got a bone mineral density and it's 1 or 0.5, you probably don't need to do it again for another 15 years. So it depends on where you are and what the risk is. But again, the reason I'm bringing this up, my physician colleagues have been a little lax in following this. And unfortunately, the older people get, the more lax they get. So you get used to asking your docs about bone mineral density and what you are. You have the right to know where you stand and what could be done about it above and beyond exercise. So what can we do about osteoporosis beyond exercise? So we mentioned vitamin D and calcium. It's always been the recommendation to take vitamin D and calcium, particularly women. No reason not to. It's as long as you're not taking excess doses. But the big thing about vitamin D and calcium, it has been shown not to reverse osteoporosis or fracture risk. So thinking you're drinking your milk or taking your calcium and vitamin D, data have not supported the reversal of fracture risk. So what can you do? Well, you've heard me say this over again. Get moving, weight-bearing exercise. Now, unfortunately, most of us, most physicians know, and I think you know yourself, most of us won't do the amount of exercise we need to really reverse the osteoporosis. And that's where medications come in. Medications can greatly reduce fracture risk. And there are two classes of them. One, drugs that decrease bone breakdown and drugs that increase bone formation. And I'll make an unequivocal statement, and you'll run into physicians that, I don't know about it. But the data show that these drugs far, far outweigh the risks. So what are the drugs? So here are the drugs that reduce bone breakdown. And I'm just going to mention these because some of them I'm sure you've heard of. Drugs that you take orally. One of the oldest one and one of the most effective one is alendronate, also known as Fosamax. It can be taken daily or weekly. Risedronate, Actonel, daily, weekly, monthly. Abandonate or Boniva, taken monthly. Then we have IV agents. Sometimes you want to reverse osteoporosis much more rapidly. Well, we have Abandonate, Boniva, which you can give IV every 3 months. Or zoledronic acid, also known as Reclast, 1 or every 2 years as a short 10-minute IV injection. For people that can't take these class of drugs, we've got another agent, you see this on TV, called Prolia. It's we call a subcutaneous anti-RANK ligand biologic. It's also known as denosumab. This is an injection, subcutaneous injection, that's given every 6 months. Now, where this gets into trouble is that several years ago it became known that taking agents that decrease bone breakdown, some individuals got adverse events. These adverse events really are two types. One, an atypical fracture of the hip, which can be readily treated, and the other one is bone death in the jaw. Now these are relatively uncommon, certainly less than 2% of individuals that take these agents. And most of the individuals that have had these adverse events have been in individuals that are getting treatment for cancer and bone metastases. But the critical point here is that the data show that these bone agents that decrease bone breakdown will prevent 4 to 5 fractures for every atypical fracture that occurs. So the potential benefits far, far outweigh the risk for these drugs. So speaking for myself, and if I had a high risk for falling and I knew it was osteoporosis, I would take them in a second. I wouldn't even give it a second thought. Now, what about drugs that reduce fracture risk by increasing bone formation? Well, here we've got an agent called parathyroid hormone, which is given as an injection daily. You may have heard of one brand called Forteo. Usually don't take it for more than 2 years. It's very effective. The problem with it, it's still relatively expensive. It's inconvenient. You gotta have a shot every day.